First of all, talk about the signs.
Okay.
What are these signs and the behavior that we need to watch?
Yes.
Because, like in other physical illness, if you have cancer, there's certain kind of things we look at. If it is corona, we have kind of behavior and other things that we look at it. Your temperature, your breathing system, and everything else. But for the depression, we don't look those kind of variants because depression is not virus. What we are going to look is behavior. But this behavior becomes so much that it affects your way to function. What are these behavior we are talking about? When you see an individual, in other words, is how would you tell first of a person is depressed?
Exactly.
And then, at what time shall we, as professional, declare as a mental health illness? So there are feelings there are certain behavior that we need to look from a person.
Yes.
For example, when you see somebody now feeling sad all the time, amekasirika, with no reason, having depressed mood, with no any excuse, you start wondering what is going on. Loss of interest or pleasure with the things that you used to like to do, things you enjoyed all at once. You enjoyed being with your friends, you enjoyed with the cooking, you enjoyed swimming, all at once you say, I'm not interested, I don't want to do those things. You find some people eating too much or losing weight too much, going from one extreme to the other. This kind of behavior on unrelated kind of dieting, we watch all these behaviors.
Okay.
Loss of energy or increased fatigue. Increased fatigue. Every day you are tired. Every morning you wake up, you are complaining. You are tired. You don't even want to go to work. You feel even going to work, you are not productive. You are feeling tired. You have no energy, complete loss of energy. Increased this behavior, we call it purposeless physical kind of activity. When you go to wash your hands, it's like you don't want to wash. It's like somebody's
just pulling yourself.
Pulling yourself. We are forcing you to do something that you don't want. If you are walking, you find yourself from here to there. You are just not yourself.
Yeah.
You are just pulling yourself. There is this feeling of worthlessness. You don't feel important anymore. You are feeling guilty of everything.
Even what you not have done.
Even when you are not.
No reason
Exactly. And then you see completely you have no self-esteem. You are worthless. You consider yourself with others, you find you are nothing. Difficulty thinking and concentrating in making decisions. At one time, as a pastor, you know you can make a very good decision, quick decision. Yeah. You come to a point where even making a simple decision becomes impossible, a problem. Okay. Thoughts of death and suicide, they come as a result of all those behaviors. As a result of all those combination of those behaviors I've talked about, you start developing sense of hopelessness, and then suicidal thoughts, death. You start talking about death. When you see all those combinations of those behaviors, 75% of those behaviors, they don't have to be 100%.
Yes.
75% of those behaviors.
A percentage.
Yes. And they are exhibited. Now it comes now to your question.
Yes.
At what time do we tell a person is depressed? When you see those kind of behavior exhibited for a period of 2 to 3 weeks on a daily basis, continuously, then that is normal. It is a total depression. Wow. It's a total depression. Wow. When you see all those exhibited for 2 to 3 weeks, then we call it major depressive disorder.
So it means that we like have to watch out for somebody. A depressed person, will they really know that they are depressed? Will they accept? Will they even know they have a problem?
They know they have problems, but they don't. Not everybody admit, especially in African culture. You know those problems are there, but you don't want to, because of the stigma associated with the mental health. Yes. You don't admit it that you're a problem, and most of the time you hide and you say, "I'm just tired, I'm just fatigued." But there's more than that, and you find somebody is either eating too much or you are losing a lot of weight, have no appetite, but they will not admit that this is depression because they don't even know themselves it's depression. Yeah. But me as a clinician, you as a pastor, you can see this is not the same person. this is not the same person
They're
who
not
you
acting
enjoy.
the same way
Yes,
they used to
and
be.
so it is quick to judge that person
Mm,
with negative things because that's the way we are socialized as African culture.
mm.
Instead of looking at this person and say, what is going on with this person? 3 months ago was very active in the church. 3 months ago was very good person. There has some triggers,
Yes.
there's reasons why things are going the way things are going.
Hi.
That's
Yeah.
where we come now to start educating people and understanding. When you see those kinds of behavior, don't think some person is just crazy.
No, they
No,
need help.
they need help. And do not ask for help
Oh.
until you have educated them and helped them.
Mm.
Because this culture, African culture, is not used to this.
Yeah, we are not.
We are
We are
not.
not.
But for me, when I see this kind of person, then I'll say, this person will need help.
Actually, most of the time what happens is that we assume that maybe somebody just don't want to hang out with other people.
Correct.
Maybe they're just keeping to themselves. We also don't know where to come in and help. And again, now if a person is exhibiting all this, you want to help and they do not want to be helped, or they do not want to accept your help, what do we do?
Unfortunately, here in Africa, we don't have the laws that mandate that kind of behavior.
Yeah.
In US and other Western society, countries, if I find you that you're in that condition, very severe, depressed, it will lead to suicide.
Yes.
It will lead to hurting yourself. What personally I would do, as I'm licensed, I will commit you to hospital, whether you like it or not.
Mandatory.
Mandatory for 72 hours. And when I put you to hospital for 72 hours, we'll be able to deal with all those problems until you come to a point where you can be able now to start reasoning. You either choose to continue or you discharge yourself.
Okay.
But in Africa, this is where we really have to, and we shall talk about it, how can we help someone
Yes.
to be able to understand this is a problem so that we can be able to give help.
Yes.
It is a question of now how do we approach it, and I believe you have that question somewhere down the road, how we can do that. But we'll talk about that, how to be able to help such a person. But let's ask ourselves first of all, can this kind of behavior be managed?
Exactly. Because now that we have, somebody does not want to wake up in the morning. When they go to sleep at night, they can't sleep. They don't want to eat, they don't want to go out, they don't want to do anything. And they're just indoors. Maybe it's just an elder sibling. And in the African culture, I'm supposed to respect them and give them their space. Now, when it comes to managing all that, what do I do to help?
And this is why we say, because of lack of knowledge, we will not be able to recognize that this is a serious problem. Sometimes we just say somebody doesn't want to wake up. Sometimes we just say that he is, especially the girls, she just want to eat too much.
Yes.
Or the boys, they say they don't want to eat anything. Or the girls,
the age.
The age. So what I was saying is, when you see the combination of all the behavior that I talked about, and you find they are consistent for a period of time, you must understand this is not normal.
Yes.
Unfortunately, because it's not corona, where you are unable to breathe, where you are unable to function, where you are sneezing and coughing all the time,
and fever,
and the temperature going high.
Yes.
This is somebody who is just lazy. There's a tendency of us Africans saying this person is just being lazy. He's just decided to be lunatic,
and we
don't
make
want
noise to them.
and
Actually, we will be so
that
hard
is
on
not
them.
the approach for a depressed person. When you approach a depressed person like that, and we'll talk about that, it means you're making it even worse.
Okay.
But the question here is this person really mentally ill? With 75% and 3 weeks continuous exhibition or exhibiting this behavior, it is a severe problem, Pastor.
How do we put a line between the mild and the severe? Does the mild one need medical attention?
No. And that's why we talk about how do you respond to depression? How you are going to respond to depression.
Yes.
In other words, how can you, is it manageable?
Mm-hmm.
And what kind of depression is it manageable? Because there are different modalities and approaches we need to use in order to approach depression.
So maybe we can talk at this point about those modalities and how to manage it, so that we can know how do I approach a mild depression.
Correct.
And how do I help,
Yeah.
and what do I do with the severe cases.
Correct.
Maybe you can guide us on that.
Let's first of all agree that depression is, as I said, is a treatable mental disorder.
Yes.
It can be treated. For those people who agree to look for help, 80 up to 90% of the people with depression eventually respond very well to treatment.
Wow, that's
80
encouraging.
to 90%
Yes.
of the people who are willing to attend,
Yes.
and if they have got the proper clinical treatment, they will respond well and they'll be treated.
So first of all, there has to be willingness on the part of
There
the patient.
willingness, and we also have to somebody who understands how to respond
Yes.
to treatment.
Okay.
Because one of the major things we have in Africa, we do not. The other day we said everybody going for 3 months training is calling himself a counselor.
Yeah.
Everybody 3 months, 1 year, a counselor. When you are dealing with the severe depression, it is not just a 1 degree
Yes.
kind of approach.
Oh.
For a doctor to open your heart, this doctor has gone an extensive training of 10 years to be able to open your body.
Wow.
Why we think that mental health can be treated by somebody who have gone for a 3 months course,
yes,
or 1 year,
yes,
or only 1 degree to be able to deal with depression and schizophrenia and bipolar, it is completely disgrace
wow,
and abuse of profession.
Wow. Maybe that takes me to something that there is a report that was released the other day to the government. It was led by a senior psychiatrist in this country, Dr. Njenga, whereby they said the committee did the research, and it was noted that 1 out of every 10 people in Kenya are depressed. 1 out of 10. And to me, that's saying, like, in a congregation of 100 people, 10 people are suffering. And that's now, and we do not have the legal body to address all this. Because in Kenya, as you say, the registration of mental health practitioners, it's yet to be done, I think. Most
Correct.
of them are associations. So there is nothing to monitor. There is no one to monitor who are practicing. Like we have with nurses, we have with surgeons, we have with dentists.
Who are
In
certified
Kenya, we do not have that single body that can be able to deal with the
credential.
mental, yes, the mental health practitioners.
Credentials are very important. A doctor cannot be a doctor until he is certified and has passed the exams,
yes,
with medicine. And nurse, they have to sit for credential examinations. Why not mental health in Kenya? This is the problem. We are saying that we take mental health so lightly. It is not an illness.
Yes.
But mental health is a serious illness, as Dr. Jega said. 10%, for 1 out of every 10 people is depressed. And probably some of them even are severe depression that require clinical and medical attention.
Yes.
But we do not have people who are professional. Why can't our government take the initiative in the mental health and say, equally the way we credential the nurses, the doctors, and other people, the same way we need to credential the mental health workers. Everybody is now calling a severe depression, Pastor. A severe depression, you're not going to be able to address it with a 1 degree approach. This is where we have the PhD psychologists and psychiatrists who are able to deal with this. And we'll talk about this managing the high levels of this one. And I think we were discussing this. Number one, as I said, if it is well managed, 80 to 90% can start functioning normally.
Yes.
But how do we manage number one? It brings you to your question, either mild or severe depression. If it is just a mild depression that you are just sad for 2-3 days, or you are just not able to sleep for a couple of days, or you are just fatigued for 3 days. You have not come to a level that you are not able to function. I can still be able to push you and be able to do a few things. You are coming to work, you are feeling you have no energy, you have no interest. But because the demand, I will still expect you to perform,
Yes.
and you are going to lose your job if you don't to do so,
Yes.
then you'll be able to pull yourself and be able to do that. Those are kind of mild kind of behavior.
Yeah.
This kind of mild behavior can be managed through psychotherapy.
Okay.
Through what psychotherapy? It because you can be able to deal with it without using medication. And psychotherapy, and that's what I'm saying, there are certain different approaches and theories of counseling that we use. And you're not going to use one particular theory for everybody. Just the way you don't use one medication for all the illnesses.
Yes.
We don't use all the aspirin, or we don't use the
Panadols.
Centris or Panadol to treat malaria. We don't use it Panadol to treat cancer. And this is where people need to understand that even when it comes to mental health illness, and education is important. When you talk about psychotherapy, there are different theories and approaches that I need to be able to deal with somebody who is depressed. For example, somebody who is like this, mild, I can use what we call a cognitive behavioral therapy. And a cognitive behavioral therapy, what I'm dealing with this kind of a person, it is the way you help this person to start thinking and to rationalize things. You are dealing with cognition. It's cognitive. You are executive thinking. So if you know the approach of being able to use the cognitive behavioral therapy, you'll be able to help this person. Now, if you are use other methods, because there are different theories in counseling,
Yes.
some of them may not be effective. And this is what I'm saying. Our government and our system, this need to start using credentializing people, professionals, so they can be able to address such severe mental health illness.
Yes.
Now, that is mild. Let's talk about the severe mental health.
Okay, so
the severe depression.
Maybe to take you back, for the mild one, as you have said, I can be able to pull myself.
Yes.
Go to work.
Correct.
I can pull myself to attend a social gathering.
Correct.
Even though maybe I'll not, but I'm just pushing myself.
Yes.
Does it mean that if I push myself so much, tomorrow it's going to get worse?
Not
because
necessarily.
not like I have the strength to do it.
When we talk about mild, it means it's just a distorted way of thinking.
Okay.
When we talk about mild, it's just distorted way of thinking. When we use for example, the cognitive behavior therapy, it means I'll be able now to help you to start focusing on your thinking. And when you start thinking, and I would lead you, there are certain ways that I'll be, as a clinician, I know how to go about it.
Yes.
There is a way that I'll be able to lead you to that level of coming in terms with your thinking and start rationalizing things. So you can change that kind of behavior of thinking, and you don't find yourself pushing yourself. You find yourself functioning.
Doing it.
Yes.
Okay.
That is mild.
So when it comes to the psychotherapy, is it some talk we are going to have? Is it exercises that I'm going to be given?
It is talk. You and I will talk.
Okay.
It's a talk therapy. In fact, that's the word you probably I would have used it. It's a talk therapy.
Okay.
I just help you to rationalize. It's just, for example, if you're going from here to Nyahururu,
yes,
there are different ways you can go. You can choose to go through Naivasha, and you can choose to go through Subukia. You can choose to go through Dodori. But I would like to take you the easiest way and the smooth road.
Yes.
When you start with those kind of mild behavior, it means you are now rationalizing things and going the wrong way instead of going the right way, and then it affects the way you think. So my job as a clinician is to deal with your cognitive behavior.
The way of thinking.
The way of thinking. And I'll start changing you and helping you to look things in a different way. And that is functional because it's mild. But when it is severe, that is not enough.
It has now to be combined with something else.
When it is severe now,
yes,
we have to combine it with medication.
Okay.
And this medication, we are talking now about the brain chemistry. The brain is distorted now. and now it may contribute to an individual's depression, the brain itself, distortion of the brain. And that's why we use medication. We call it antidepressants.
We've heard so much about antidepressants,
Antidepressants
but
can
we
be
just
prescribed.
think it's just something we can buy in the shop.
No, there are so different kind of antidepressants medication, and therefore depending on how you can take and how it can, the side effect it can have. Whenever we prescribe psychotropic medication,
Mhm,
like for depression antidepressants,
mhm.
that need monitoring and the blood work every month. We have to do the blood work to see how things are going. We have to see the side effect of those medications. If they don't respond to you, to this individual well, then we have to change to something else, to other
Wow.
kind of medication. So it's just like even in your illness, there's some medication work well with you.
Mhm,
I'm on cholesterol.
mhm.
There are different kinds of cholesterol medication.
Yes.
There are some that I tried
Mhm,
and my body did not take it. I was trembling on my body.
mhm.
Now I realize I'm using Ritalin or I'm using Lipitor, the one that will work for me. So it is the same case with depression. There are medication that work well, then there are some that do not work well with your body. That medication alone is not enough.
Mhm.
We want to combine it with psychotherapy.
Well, I think we will take a break, and when we come back, you'll give us a more detailed way of how do you combine now the medication and the psychotherapy to ensure that this person comes back to normal. Okay, thank you. We take a short break.
All right.